is now being recorded.
Welcome to the AADOM webinar, Wanted, an Engaged and Profitable Hygiene Team. Your host for today's program is Teresa Duncan with speaker Heidi Arndt. Operator assistance is available during the webinar by pressing £0. You can send questions at any time using the chat window located to the left of the presentation screen. A question and answer session will follow the presentation. I will now turn the call over to Teresa. Please begin.
Thank you so much, Virginia. So welcome to the 2015 Virtual Study Club session. It's great to see so many of you returning from last year. I just love seeing the same familiar names. It's wonderful. By now, you should have received an email from me with info on how to join our closed Facebook group. If you have not joined or have not received that email, please let me know, and I will be happy to resend the instructions to you. You can just put it even in the chat box, and I can send it to you via email. I'm really excited to welcome Heidi today as our kickoff speaker for 2015. The topic of hygiene education is always popular with and needed by our dental managers, and specifically, you all know how to take it to the next level, and I knew Heidi would be the one that could help us with that. She's really knowledgeable. She's a very knowledgeable educator who spent her career working in private practice and at the Mayo Clinic. She's the owner of Enhanced Hygiene and is dedicated to helping teams with topics such as leadership and teamwork, patient care, and verbal skills. She's smart, she's gracious, and I was thrilled that she agreed to be our VSC guest. She's here today to help us assemble an engaged and profitable hygiene team. Heidi, thank you so much for sharing your time and your knowledge with us today. Take it away.
Thank you, Teresa, and what a nice introduction that was. And good morning and good afternoon to everyone. I am actually on the West Coast. I'm in Portland, Oregon, where it's still morning time, and I know many of you are probably enjoying lunchtime while we go through the webinar. Today, I am so excited to share with you about dental hygiene. It is my passion. As Teresa said, I've been a dental hygienist for years, and the owner of Enhanced Hygiene, where we are committed to helping dental offices create profitable and engaged hygiene teams. I want to start off by asking you a simple question. Who in your practice is responsible for 30% of your total practice revenue, is the reason why 80% of new patients come into your practice, and where 60 to 70% of your restorative treatment is discovered? I bet you know the answer. It is your hygiene team. When I look at the value of a hygiene team in the practice, sometimes we think of them as just the cleaning lady, or maybe we think of them as the necessary evil in some practices, as I've heard before, although I do not like that term. But the value of your dental hygiene team is huge. In so many ways. They are the cornerstone of your practice. It's where 30% of your revenue is generated, and your patients want to come to the practice to see their hygienist. They want to come to the practice for their regular visits because they have that relationship with your dental hygiene team. The dental hygienist is responsible for not only a large part of your business, but they're also responsible for providing this valuable level of care to your patients. However, oftentimes the dental hygiene team does not understand the accountabilities they have to the practice, and maybe they're also a forgotten entity in many of the practices because of maybe the difficulty on how to talk with them, how to create a motivated team, how to get more productivity from them. There's always a large variety of concerns that come with working with the dental hygiene team. I want to have you look a little bit into the eyes of a dental hygienist, and actually I'm going to tell you a little story about myself. When I graduated from dental hygiene school over 16 years ago, I walked out of graduation thinking I knew it all. I had passed 2 boards. I'd gone through this tough curriculum in dental hygiene school. I was now licensed to go out and take care of patients. I thought I was ready until I walked into my very first practice. I remember walking in the first day poised to take care of the world, and I soon found out that there was a lot more that I needed to learn. My biggest concern was how was I going to take care of a patient in 1 hour versus the 4 hours I had in school. So time management became my biggest concern. How was I going to talk to patients about treatment plans and expensive dental treatment? After all, everything in hygiene school was $20, no matter what they had done. I also had to learn how to talk with my doctor and make sure that he was on board with the recommendations I gave my patients. There were several things that I needed to learn that I did not learn in school. So what I soon learned is that the development of myself and every dental hygienist really started when they hit the practice. You have likely experienced the same thing with many of the hygienists in your practice. Some hygienists rise to the occasion, are productive, are committed to the success of the practice immediately as soon as they start the practice. But others step into the practice not knowing what they walked into, thinking that the dental practice is going to be just like school, and it's not. And what we see happening to the dental hygienist that is not ready for the integration into the dental practice is that they oftentimes become stuck. Dental hygienists become unengaged. They're meeting burnout. They're not motivated. They could be even frustrated. So what is it that creates an engaged hygiene team? And does hygiene team, an engaged hygiene team, mean that you have a profitable and productive team? According to a recent Forbes article that I read, employee engagement is the emotional commitment the employee has to the organization and its goals. They know what is expected of them, and they know how their work contributes to the success of the organization. Based on that definition, do you feel your hygiene team is engaged? At Enhanced Hygiene, we believe that there are 3 keys to getting your hygiene team engaged, and we do believe that an engaged hygiene team equals a profitable team. Today I'm going to go over 3 key aspects to help you get your hygiene team engaged, because I believe that the practice manager plays a huge role in getting the engagement of the hygiene team to where it needs to be. I believe that the practice manager in the office is the cornerstone of the office and really the one that can set the tone and the pace for the office. So the 3 keys that we're going to talk about are the why, the how, and the what. Why do they do what they do? Your dental hygiene team needs to understand that. It may seem basic, but it's important for them to know. The second one is how. How will they do it? How are they going to get there? And finally, what does it look like? What does success look like? What are the tangible means in which we can measure those? The first way of engagement is why. Why do we do what we do? The focus in most of your offices, actually all of your offices, are on comprehensive patient care. There are several ways that your hygiene team can immediately impact the health of your patients, but I want to break them down into 2 simple main points that your hygiene team can impact your patients today. I like to keep things simple because simple is what it gets implemented and what gets changed. When you walk away from the webinar today, I want you to use these 2 patient care focus areas as ways to improve your practice today and really give your team the big why. So you see on the slide here that our first focus is periodontal disease. Now you're probably thinking, Heidi, I have been hearing about periodontal disease for years. Since the 80s, soft tissue therapy has been a hot topic in practices across the country. However, if you have not refreshed your protocols or your knowledge since the 80s, it's time to do so. Periodontal treatment is still the biggest focus for the health of your patients and the growth of your hygiene team. According to some research published in 2011, 1 in 2 U.S. adults has some form of periodontal disease. That rate goes up to 74% for patients that are 65 years and older. Think about the number of patients that are coming in and out of your practice every single day. Is your hygiene team delivering periodontal treatment plans to fall in line with these statistics? If not, this is your number 1 big opportunity to improve the health of your patients and also the health of your practice immediately. Let's take a look at what the reality is when it comes to periodontal treatment in practices that we see today. Most dental practices are still focused on delivering a cleaning, which is demonstrated on the slide below, And if you looked at the pie graph on the left, it'll show you that the prophy is 77% of the procedures that are happening in the practice when you compare them to scaling and root planing and periodontal maintenance, which are truly your periodontal procedures. Why do you think this is happening? Why do you believe that the prophy is still the most common dental hygiene procedure provided in practices today? When we're out coaching our clients, we hear a lot of different things. We hear from the hygienist that it's because of insurance, although we know that insurance should not dictate or direct our treatment recommendations to our patients. We also hear from the hygienist it's a lack of education. Education really falls on the shoulders of us as hygienists, so that's a great point. But maybe it's because your hygienists are actually providing periodontal treatment but not charging the patient. And that is truly the most common thing that we see in practices today. Your dental hygienist is most likely providing services to your patient without using the appropriate periodontal codes. Why does that happen? Well, I think it's a deep drawn issue, and there's many reasons why that is happening. And I'll give you a little bit of forte on what my thoughts are on this. In dental hygiene school, we are taught to scale to completion. So one of the things in dental hygiene school is we have a patient in front of us. We need to provide appropriate care to that patient. We do not have to worry about CDT codes. We do not have to worry about fees. All we are worried about is getting to the end of the appointment when our instructor comes and does what we call a calculus check for us, because if we pass that, we know that we're going to pass that patient. And so that is the biggest factor that we're focused on throughout hygiene school. So then when we get to practice, our main focus is to provide that cleaning to the patient. And oftentimes that falls in the line of using the code D1110. I also believe that we are scared to communicate with a patient. Oftentimes talking to patients about periodontal treatment means expensive out-of-pockets or expenses that are going to have to come out of their pocket because their insurance may not pay for it. It may be the first time they're ever hearing it. It may be that the patient's been coming to the practice for 20 years, and how on earth will I tell them? We don't want to have those uncomfortable conversations, so we're going to just clean them up and move them along. And so your dental hygienists are likely falling into one of those categories and leaving opportunities on the table. If you were to position your hygiene team to a 60-40 split, as I'm representing on the right with a graph, this could add $31,000 to your practice, and this is looking at a practice that has about 2.5 hygienists, so 2.5 hygienists working in the practice. I look at that amount of money and I think, wow, that's a huge amount of growth for the practice, but also think about the patients that are getting appropriate care. So one of the things that you may want to ask your team is, are we leaving money on the table? Are we leaving opportunities? Are we giving away patient care for free? And I can tell you, when you get to the root of it, a lot of your hygienists will admit to doing care for free. Pretty alarming when you start to think about the volume of how much this is happening in the practices. The second big opportunity in why we do what we do is dental caries. We've heard a lot about prevention in the last 10 years. In fact, there has been a huge upspringing of caries management, caries risk assessment that many of you have heard it. When I was in dental hygiene school, this was not part of the curriculum. But in some schools today, this is now part of the curriculum. And if you've gone to any of your state dental meetings, you'll probably notice a wide variety of topics regarding caries risk assessment, the management of dental caries, or minimally invasive dentistry. It is a hot topic and a hot focus in dentistry today. Dental caries is the most prevalent disease in children and adults. 93% of patients 65 and older have a caries risk. 50% of patients over 75 have root caries. And in general, over 80% of your patients are at that have a dental caries risk. So again, think about the number of patients coming in and out of your doors each day. You can almost guarantee on the statistics provided to us from the ADA and from Canberra that 80% of those patients have a caries risk. In other words, They will all need preventive help from your team, and this prevention will come in the form of sealants, fluoride, and prescription strength fluoride, xylitol. There's many different offerings out there. And I have to tell you that when I started looking at Carrie's risk assessment programs and at Canberra, I realized that it's a lot of information, and a lot of teams have a hard time implementing all that data into their office, trying to determine what is the right thing that they should offer. So I believe, again, in simple systems, but simple gets implemented. And so I'm going to show you a couple of simple ways in which you can deal with that in your practice too. But let's just first look at another practice. Here's the reality of what we see happening in the typical dental practice across the country. In this example, over 350 patients were seen in the hygiene chair. This would be for periodontal maintenance, an adult prophy, and for a child prophy as well. Yet only 54 fluoride varnishes were provided and only 5 sealants were placed during this month. Do you see the gap here? The gap is huge, especially as we relate to the statistics we just talked about. Over 80% of your patients walking in and out of your doors of your practice will have a caries risk. That means if you were to have provided 80% of fluoride to these patients, your hygiene team could have added another $8,000 to your revenue for that month. That's a huge amount of revenue, again, for a simple preventive procedure that your hygienist can provide the day of. This isn't something that has to be treatment planned in advance for 6 months from now or 3 months from now. This is something that you can add to your bottom line today. Now, I am not the insurance expert, but I'm sure the questions will come up in regards to fluoride varnish, and I'm open to those when we get to the Q&A. Because there are, and I'm sure that Teresa can talk about this as well, there's a lot happening in regards to prevention when it comes to reimbursement for fluoride. But again, typically the fee for this is about $30 per application across the board, although fees do differ. Let's look at the sealant aspect. Well, sealants appear to be the standard of care in most dental practices. I continue to see that they are very, very minimally placed. In fact, as we're out coaching clients, we get a ton of pushback from the dentist about placing sealants. There's definitely some different philosophies out there today regarding sealants. However, I always reference back to research with those the dentists that question this to show them the huge impact that sealants offer to our patients. So I encourage you, do not let sealants become a forgotten preventive opportunity in your practice. If you are focused on just giving them to the children, that's great, as I depict in this slide. If you just want to provide them to children, although in all the caries risk assessment information from the ADA and the information from Canberra, it talks about the importance of sealants for all ages. Sealants can be a large revenue boost for your practice as well. The dental hygiene team is educated on placing sealants, so they absolutely can place sealants in your practice. Although some dentists like to place them in their chair, the bottom line is you don't want this to be a forgotten aspect because it's a huge opportunity for the health of your patients and also for the health of your practice and your revenue. So once we understand the big why, your dental hygienist will understand. Your hygienists are typically going to respond to why is it important, and that's providing important health care to your patients. That's why they do what they do. They're in the patient care focus. They want to provide great oral health care to their patients, and that is their main focus. So this is really your why. The great why that leads into what you're focused on as an office manager is the opportunity of revenue growth, which should be important to all of us. So let's take a look out of these 3 opportunities, what the impact would be. So we talked about adding a $31,000 a month in the Perio Avenue, $8,200 when it comes to fluoride, and $1,150 when it comes to sealants. That would be $40,000 extra every month if you were to tap into these opportunities in your practice. Pretty amazing, huh? No matter if you went halfway there, heck, I think a $20,000 increase in revenue in your hygiene would be awesome too. And these are on 2 simple aspects, periodontal care and prevention. something easy that can impact your practice already. This here is a 30% increase in 1 month of your revenue. Imagine what you could do in your practice with the revenue numbers increasing by that much. You're probably thinking, Heidi, this is all fine, this is all great, but what's stopping them? How do I get my team engaged? And that's why we're all here. We recently polled over 350 dental hygienists from across the country, and there were a few themes that appeared when we asked the question, what stops you from implementing necessary patient care and revenue-generating changes in your practices? The answers fell into 3 categories: time, lack of clear expectations, and what's in it for me. Those were the 3 themes that came true. I think from hearing my early story, you can understand why time is such a concern, and this is probably what you get hit with as well. You ask them to do something different in their day, and your hygienist will say, we don't have time to do that. You want to be considerate of time because it's probably the number 1 motivator for your hygienist if you recognize time and help them understand how they can fit things in. Now, there is no doubt, I think every dental hygienist needs help in time management. I did. Remember, I went from a 4-hour patient to a 1-hour patient in a matter of weeks. So what I did is I started to carve out things for my appointment just to survive. You want to make sure that your patients are receiving optimal care in the time allotted from your hygiene team, but you also want to show your hygiene team how to make it through appointment and provide all of those aspects of care. The second piece is lack of clear expectations. The hygienists are unclear of what's expected of them. If you ask a hygienist, before we go into a client, we always ask them, what is expected of you? And I hate to say it, but a lot of them will say, to clean patients' teeth. And that's probably the response I don't like to hear, but that is the answers that we are getting from a lot of hygienists, which tells me we need to tie them into goals. We need to tie them into bigger expectations and clearer expectations, which we're going to talk about in just a minute. And the final thing is, what's in it for me? What's in it for me may be financial. It may be, how are you going to help me create more time or allow me more time to complete necessary care? There are always things that are going to motivate us. Think about yourself. Oftentimes we all do look for a what's in it for me. For me to get up at 6 a.m. and go to a spin class, I have a little bit of a thought in my head as what's in it for me. Am I going to go drop a pant size? Am I going to feel better? I want something that's going to bring value or benefit back to me. So although it may sound a little bit selfish, I think that everybody has a what's in it for me locked up deep inside of us. So let's talk about time and really getting to the key engagement of the how. Oftentimes, hygienists need to have a straight agenda of how they're going to execute their appointment. How are they going to get there? You want me to improve the periodontal care of our patients. You want me to implement Canberra and Caries risk assessment care into our practice. How am I going to do that? One of the first things your hygiene needs to do is find time in their appointment to do it. If they feel rushed, the first thing that's going to fall out of their appointment is the patient assessments. Patient assessments are the most important phase of the appointment, not the cleaning. Yes, your dental hygiene team must take ample time to complete the assessments. In fact, this is the first thing that we train when we go into dental practices, is completing a comprehensive assessment, which will take about 20 minutes of a hygiene appointment. This is where they go in and they do a 6-step assessment looking at risk assessment of perio and prevention. They take intraoral photos. They look at restorative needs for the patient. They do the life-saving oral cancer screening, and they complete a comprehensive periodontal assessment. Without a 6-step assessment, your office and your hygienist will continue to provide the common prophy to every patient that walks in your door, and you will not be able to capitalize on the offering preventive services. It all starts with the assessments. I go to a dental practice here in Portland, Oregon, and they have no idea I'm a hygienist. They have no idea I do anything in dentistry. I just go as a patient. Maybe I'm a secret shopper, but it's really fun. The first appointment there as a new patient they knocked it out of the park. They did a complete assessment on me. They handled all of my wants and needs. They were amazing. I thought, gosh, this practice has got it going on. I've been there 3 times since for my recall appointments, and what I have found is that the hygienist will take me back. They'll ask me the simple question, any changes in your health history today, Heidi? I will relay any information that's appropriate to them. The hygienist immediately tips me back and starts scaling my teeth. There was no oral cancer screening. There was no photos taken. She did not look for any restorative needs in my mouth, and there was no probing. You can imagine what happened throughout that appointment. The hygienist was clearly focused on cleaning my teeth. The doctor came in for the exam. The doctor says, how do things look with Heidi? And the hygienist's reply was, everything looks great, because they were not taking the time to look for the opportunities for health. So I encourage you, if there's one thing that you could help with your hygienist, is to talk about the fact that they need to complete a 6-step assessment before they get started with the patient. In fact, our rule is you cannot pick up a scaler until you have all 6 steps done and documented. And this is important from a risk standpoint as well. You want to minimize risk by making sure you have proper assessments for your patients. I believe this is provided to you in the handout today, so make sure you use it. If you have any questions on it too, you can ask me, but this is the fundamental piece of getting to the how. Once your hygienist has completed their full assessments, they can make a dental hygiene diagnosis. So the assessments are always going to lead to everything else. Here's an example of a diagnostic guideline that truly helps your hygienist identify where to categorize your patient. Once your hygienist has completed a periodontal assessment, for example, there's basically 3 questions they have to ask themselves. Is this patient healthy? Do they have gingivitis? Or do they have periodontal disease? Using the full assessments that they've completed, they should easily be able to identify that and follow the path to treatment. So they can identify the patient has periodontal disease, and this is the path that I need to follow to take care of this patient. In our training with dental offices, once they categorize this, we show them basically the flow chart to taking the patient from start to finish in periodontal treatment. Make sure that this is really clear to your team, because this is really where the gray area comes from the dental hygiene standpoint. If you leave it up to each individual to kind of decide what fits for them, they're going to do what feels right for the time and not necessarily follow the protocols or the philosophy of your group. So this is an example of creating a strong how. How do they get there? They know why it's important, but how do they make it real and make it implementable into your practice? Treatment acceptance is always a hot topic as well in dental practices, and it's one of the things that I've noticed is different from hygienist to hygienist. Some are really great with communicating with patients. Others are not so great at communicating with patients. What we have found is by completing the comprehensive 6-step assessment with your hygiene team, you are talking with your patients constantly through the assessment. It's basically the co-discovery, co-diagnosis process that you need in your practice. So what we like about doing the 6-step assessment and intertwining basically the treatment acceptance is you personalize it with the patient, you make it relevant to them, and you can focus on the benefits to the patient. Remember how we talked about the what's in it for me as a hygienist? Your patients also have that. What's in it for me? What are the benefits for me? Here's an example. Mrs. Jones, I'm so glad that you and your physician are working to get your diabetes under control. In order to help that process, we need to ensure that we get the infection in your mouth under control right away. Once we get your periodontal infection under control, you will notice a big difference when you're brushing and flossing, and you'll find it easier to control your blood sugar. So what we have done on that is we've personalized it. This patient has diabetes. They are being treated by their physician, and they're having difficulty controlling their blood sugar. We made it relevant to them by talking about all these things that pertain specifically to them, and we've also focused on the benefits, reduce the bleeding, and make it easier to control their blood sugar. When you hear something like that, it's very hard for a patient to say no because they see the benefit that will impact them right away. We're not talking about how we're going to do a deep cleaning and clean out the pockets. What does that mean to a patient? Why is that important? But when you tie up something specific to them, they're more apt to follow through. So as you can see, everything leads together. You have to have the assessments involving your patients in order to get your patients to say yes. It is important to tailor treatment recommendations and discussions around each personal need of your patient. If you don't adequately assess your patient, you will never be able to have a patient that says yes, and you'll actually spend more time trying to convince the patient to follow through with treatment than ever before. Let's also take a look at prevention, since we talked about this as one of your other focus areas. When assessing the caries risk of your patient, your dental hygienist will be doing a risk assessment and identifying the categories that fit into low, moderate, and high risk. Remember, over 80% of your patients will fall into these categories. This form easily shows your hygienist the risk factors that tie into this. I'm just going to give you a couple as an example so that you understand what puts a patient at risk. If you look at the yellow box, you will notice that there is some risk levels that are identified here. I'm just going to kind of point it out in this box here. If a patient has had a carious lesion in the last 36 months, they are at risk. If they have visible plaque, unusual tooth morphology, so possibly deep pits and fissures in their occlusal surfaces, if they've had interproximal restorations, if they've had white spot lesions, which is basically where this tooth is starting to break down, exposed root surfaces, open margins, ortho, dry mouth, or even partial dentures, your patients are at risk. Typically, when clinical team members read this list, they're like, Heidi, that is virtually everybody that is at risk. And that is exactly right. So again, your team has to identify the risk level or the need of that patient, and then you can tailor in appropriate treatment for them. Again, as I remind you, any patient that is at moderate for high risk will need fluoride varnish, will need a take-home toothpaste, is going to need preventive measures from your team that you can provide every day. And guess what? Your dental hygiene team is educated on these areas. It's easy for you to implement immediately into your practice. So Heidi, again, how do you engage them? We've talked about two big clinical and revenue-generating opportunities within your practice. But how do I get them to implement? How do I really get them to be engaged? We've talked a lot about the what's in it for me. Well, that rings completely true again as we talk about this engagement. Engagement means that we need to know how they fit in. They want to know how they fit into the practice. They want to understand how this patient care benefits the practice and how they contribute to the practice. Do your hygienists understand the business of dental hygiene? Do they appreciate the fact that dentistry is a business? If not, this is definitely an opportunity for you to educate your team as office managers, because this is an area that is always a little bit difficult for the dental hygienist to understand. The survey that we did last year, we talked to the hygienists and we asked them also if they knew what was expected of them in the form of metrics and goals. Over 74% of them reported they had no idea and that no goals were related to them in any shape or form. Now, many of you on this are probably thinking, how can that be? I know that I talked to my hygienist about these items, but think about, do they truly understand that? Within your dental office, you should have identified key success indicators within your practice. I am a big believer in setting measurable goals, measurable indicators that really help you understand what success looks like. Because again, not only does this tie into what's expected of them, but you can easily measure it. So you can tell them, this is what success looks like. This is what a good dental hygiene team looks like. So I want to talk with you about a few of those indicators and why they're so important. Now, here's a dashboard that we use with our clients. And of course, this dashboard has a lot of information on it regarding the practice. You'll notice at the top, we have a lot of data regarding production goals, net production, salaries, all that information. And then we dial it down into certain statistics such as fluoride per patient, sealant per patient, periodontal percentage, arrestin, and take-home fluoride. These are the areas that we measure because these dial into exactly what your your hygienists are doing with the patients in your chair. So this doesn't matter, these statistics here do not matter if you've had open schedules or not. This is what they do with the patients that they have in the chair. Because obviously we do want to keep schedules full. That's very, very important. But we also want your hygienist to be able to provide all the care necessary to the patients when they are in the chair. I call that organic opportunity or organic growth. Along the side here, we track the procedure totals, which you probably do in your practice already. And then, of course, we're tracking revenue month to month. And our profit margin we can talk about in just a minute here. Having a dashboard of some sort, I feel is very, very important for you to monitor and track the success of your hygiene team. If you are not doing a tracker of this of any sort right now, I would encourage you to keep it simple. And I'm going to show you a couple statistics that I feel is important based on the information that we shared today. The first one that I'm going to talk about is the periodontal percentage. You are probably used to seeing this one before. It's been talked a lot about it. This one has been talked a lot in the industry. There are some consultants that measure it a little bit different than I, so don't get concerned on the percentages if they look different than what you've been tracking because you've worked with a different consultant. I gave you the equation here, but basically it's looking at what percentage of patients are treated with non-surgical periodontal treatment in your practice. At Enhanced Hygiene and with our clients that we serve, our goal is between 60 and 80%. We talked about earlier making sure your mix is 60% perio, 40% prophy. This is where that comes from, this goal here. This is only looking at procedure counts. This has nothing to do with revenue. This is procedure counts. So a great information to relay back to your hygienist and something you should track by hygienist and by the practice and look for growth trends within your practice. The second one that relates to the topic we discussed earlier is fluoride per patient. What percentage of patients received in-office fluoride treatments in your office? My hope is that you are using fluoride varnish in your office. Fluoride varnish is one of the best fluoride applications we can use in office, so I would encourage you all to use that. And here are the codes that you would use in order to look at this equation. And the goal is between 70 to 80%, again, tying back to the statistics that we have heard straight from the ADA and from Canberra. This is an easy stat, again, that you can record and report back to your team. And finally, the third one is productivity. Oftentimes, practice managers will contact me and say, what should our goal be for our hygienists? And here's just some basic tools on how you can discover what it is. Your daily goal should exceed the 3x your pay and benefits for hygienists. You've probably heard the standard out there that your hygienist should produce 3 times their pay. And that is very, very true. It's a national standard out there that is still being reported, I think, by every consultant and every magazine you'll probably read in regards to practice management. The one thing that a lot of offices do not do is look at how much they're paying out in benefits. Benefits should be included in this calculation as well. And so sometimes people do not look at that. If you do not have the complete breakdown of what your benefits are, you can expect that the national average is about 20% of their compensation. Here's an example. You pay your hygienist $48 an hour, and they work an 8.5-hour day, which equals $340. You add in benefits at 20%, which is an extra $68. Your total pay and benefits for that hygienist for one day is $408. If you want your hygienist to produce 3 times that number, they need to produce a minimum of $12.24 a day. This is a simple, easy, straightforward way for you to set a goal. You understand that anything above this mark is considered, in most cases, a profit. Of course, you need to look at your whole team as a whole, but as an individual, that is your opportunity there. I find that to be the best way for you to set a goal. Don't set an arbitrary goal. Set something that has meaning, something that you're looking for in order for you to get the profit to fall to the bottom line in your practice. This is very, very important. Make sure you also explain to your hygienist how you got that goal number. You want them to understand that they should produce 3 times their pay and benefits. They should understand the fact of how they can do that. And quite honestly, all of the procedures that we talked about before, the perio and the prevention, will help drive the success of them meeting their daily goal. And the last one I want to talk about, just because I brought it up briefly, is profits. basically, to look at your profit for hygiene, you need to look at your compensation and benefits into your hygiene adjusted gross revenue. This is a number that a lot of practices do not look at, and I cannot tell you the number of practices I have contacting me on a monthly basis where this number is all out of sorts. In fact, I hate to tell you this, but I've had a few in the past 6 months that are actually paying more to their hygienists than they are bringing in revenue. So hygiene was noticed as a loss leader probably over 10, 15 years ago. I hate to say that in some practices it's still the case, and you can think about how that could be with all the insurance reimbursement the way it is. There's definitely regions and states that are worse off than others. One I can point out is right here on the West Coast. It's a very, very tough market with the insurance reimbursement and the high wages that hygienists are demanding on this side of the country. Getting your hygiene team engaged and focused on the success of your practice is important. Without an engaged team, your efforts of improving revenue they will fall flat. Take time to tie in why patients' care supports and drives your business. You have to tie in the business side of it and how they fit into the big picture. That's the key to engagement. Everyone wants to be part of a successful team. Make sure you tell them how they support the success of the practice and work together every day to make sure that you're rowing in the same direction. And then one final point in regards to engagement is I am a big believer in rewarding and recognizing people when they do really come and provide a high level to the practice. I'm a big advocate for compensation models that reward hygienists for contributions to the practice. By the way, it's a great way for them also to support that question, what's in it for me? There's many situations where we implement compensation plans in practices where the hygienists are showing up and providing a high level. It also supports the growth of the practice. Here's just an actual results from a client that we had recently that did a huge turnaround. Again, with an educated, supported, and engaged environment, your dental hygiene team can experience amazing revenue growth in 2015. Here's a small group of practices that we worked with last year, and you can see from their 2013 trend that they had some amazing and expansive growth in 2014 that really changed their practice. Guess what? You can do that too with all the information that we shared today. It's all about teaching them the how, the why, and the what. And a lot of this sits in the hands of the office manager. You may not be clinical, but there's so many ways that you can help drive the success of your team by getting them engaged and helping them understand the big picture. I believe if there's one big takeaway today that I would ask you to do as office managers is to make sure you relay what's expected from them in regards to their key success indicators. And from those key success indicators, it will help them understand how to drive patient care to get there. Here is a place that you can go to download, and I noticed a huge misspelling here. My Lord, what is wrong with me? And I noticed one on the earlier slide. It's funny how you notice these things after they're out in front of the eyes of hundreds of people. But anyway, you can email me at hello@enhancedhygiene.com. That is misspelled right there. Or you can visit our website to get more information on these key success indicators. I shared with you basically 3 or 4 key indicators that you can measure in your practice today. However, if you download this, it will give you more information in regarding to those key success indicators and how you can use them in your practice. I feel it's very, very helpful, and it'll help you immediately identify the opportunity within your practice. If you do have questions or specifics, or if you would like me to look at your numbers, I am, of course, more than willing at any time to look at your numbers and give you some guidance or information on how you can improve those. And again, you can contact me through hello@enhancedhygiene.com. It has simply been a pleasure to speak with you. I'm going to open it up right now for some questions, and hopefully you guys have some questions for me. Thank you.
Great. Well, gosh, that was that was really good. I really enjoyed. I took a lot of notes, and I apologize, Heidi. I didn't catch that typo either. I would have definitely fixed that up.
It's one of those things that pops out at you after it's out to everybody, right?
Yeah, it happens to all of us. Well, Virginia, would you mind giving instructions on how to use voice chat if they have any questions via voice chat?
Ladies and gentlemen, if you'd like to ask a question, press 7#, that's 7 followed by the pound sign on your phone now, and you'll be placed in the queue in the order received. Just listen for your name to be announced and ask your question when prompted. You can also send questions using the chat window located to the left of the presentation.
Okay, great. Well, while we wait for those chat questions to come in, I just want to take a minute to remind you about our incredibly awesome annual session. It's going to take place in Nashville on August 28th through the 30th. We do have a special event the night of the 27th, so I know lots of you are making your travel plans. If you could come in for a 6 o'clock, I believe it's 6 or 6:30 p.m. class, on the 27th, we'll get to hear Lois Banta talk about money, and I know that we all need that. She's going to talk about money and also communications, and she agreed to do a very special session for us that evening. Early bird registration is going to open up mid-February, so keep an eye out for that. If you have already pre-registered, you will get first shot at it, and so it's a good idea to go on over to the website and take a look at just doing a pre-reg, and then that way you can have advanced admission to get your classes and select your classes. You all know the last couple of months or last couple of years it's sold out, and so we expect it to do the same again. Heidi, I did see one question here, and actually those of you who are asking about separate parts of the slides, separate parts of the handouts, please make sure you click on the documents or the documents link in your invite to log into the Confertel site. There was a separate line there, Virginia. I believe it says click here for attached documents or presentation documents.
Program materials.
There we go. I knew it was something like that. So go ahead and click on that, and you should get a handout which has much of the information, all of the information that she presented today. So I have a question here from Heidi. For Heidi, I have read that the hygiene production is to include everything in the hygiene room, including exams. What are your thoughts?
Oh, that's a great question. Thank you for asking that. The way that we look at it is it's everything that happens in the hygiene room except the exam. The exam goes to the doctor. And I know there's different feelings out there. And the way that we look at that is, and I go a little bit with it, and maybe, Teresa, you can ring in on this too, is the exam, it has to be performed by a doctor. And that's why we give credit to the doctor. It also gives them encouragement to get into the room to do the examination as well. So production for hygiene is everything in the hygiene room except the exam. So thank you for asking that.
All right, and we actually have a voice caller. Virginia, could you patch Joyce in for us?
Hello, Joyce. Please go ahead.
Hi. I was wondering if you have different indicators for a periodontal practice.
Oh, okay, so you're a specialty practice.
Yeah.
I do, and it really depends. Again, I've worked with a lot of specialty offices in the years, and it really depends a little bit on the philosophy. That might be a side conversation. I do not have anything that I would just hand out in a public distribution at this point. It's usually tailored to the philosophy of the office. What are they using for technology, et cetera. So if you want to email me and we can talk over the phone about it, I would be happy to do that on a separate conversation.
Okay, thank you.
Just email me at that address that I showed you, okay?
Let me get that back up. Okay. All right, and then Jean is asking, do you recommend perio protocols? We are putting into place a scope of perio treatments ranging from gingivitis to advanced periodontitis.
And the question was, do I recommend?
Perio protocols.
Oh, yeah, absolutely. So the way that I do those is the protocols that we use a lot of visuals because your hygienist will learn from it quicker. And yes, it's important. So what we teach is basically healthy gingivitis and periodontal disease. We know that periodontal disease typically in the general practice is going to go directly into non-surgical treatment, which looks the same regardless, if they have advanced, or if they have a chronic or whatever. The only thing that's going to change is when you're referring them out. So yes, we do all those protocols on that end and make it very, very crystal clear for your team so they can implement it. And often that includes visuals. Hygienists, actually, I think we all are visual learners on some way, so that's the important thing to do. A flow chart, and most of the time what stops your hygienists from moving forward is what code do they use? Teresa can appreciate this. So making it very, very clear on what codes are used when in the appointment sequence.
Okay, great. All right, and then Trish is asking, Trish, I chuckle when I read this question. What is the amount of time that should be allowed or expected for a normal hygiene visit versus, I guess, perio and recare time? And then her follow-up comment was, time is something we can never agree on. The more time we give, the less that seems to be done during that time.
Oh, I hear you. I hear you, time. All right, so here is my philosophy, and I could go on and on about this, but I like to schedule about 60 minutes for my hygiene appointments. That means my recall patients, my periodontal maintenance patients, scaling root cleaning. If you're doing a half a mouth, so 2 full quadrants would be anywhere from it's usually 90 minutes is what we usually go to. So I'm usually looking at appointment lengths that are the 30, 60, and 90. 30 being, it could be a pediatric patient, for example, or it could be a shorter appointment, like a localized 1 or 2 areas. But here's the deal. If your hygienists are not educated on what is expected of them during the appointment in regards to the 6-step assessments, making sure that they're talking about restorative needs with their patients, they're taking all the appropriate radiographs, they're completing a comprehensive periodontal assessment, if they're not educated on that, they will not use a full 60 minutes. And I had a group recently contact me, and they are allowing their hygienists 40 minutes, and they're like, well, Heidi, it'd be chaos if we gave them 60. And I said, you're right. If you handed over 60 minutes to them tomorrow, you would not see a change in revenue at all. You wouldn't see a change in behavior either. You need to educate them on what's expected of them during that hour appointment before you would move them to longer appointment lengths. So I think what it comes to is you really need to spell out what that appointment looks like. In detail, we have an agenda that we give our hygienists. This is everything that you need to do with the appointment every time the patient's in your chair. So it's almost like a checklist, because we know if each one of those happen, the patient's going to get comprehensive patient care. Not only are we going to have hygiene treatment plans coming from Hygiene, we're going to have doctor treatment plans coming from Hygiene, which is a win-win for the patient and is a win-win for the practice. So I know that's a little bit of a long answer, but yeah, you do have to really spell it out for the Hygiene team. You can't just expect to make a time change and for everything to change. That's not a fix, although they're probably asking for that. So I hope that helps.
Okay, great. And then Krista is asking, is the production that is considered in Hygiene before or after contractual write-offs?
After contractual write-off. Yep.
All right. Virginia, do we have any other voice chat questions?
No one in queue at this time.
Okay, great. I don't see any other questions coming through.
Well, good. Well, I hope I get to meet all of them at your conference in August, because I'm planning to attend. So now I can maybe put a face to
and remember,
names.
everybody bring your boots, because I know there was even a boot contest in one of the classes last time we were in Nashville. You guys had way too much fun on the night out. I know many of you were laughing because you know what I'm talking about. So, but we have our next virtual study club on February 21st. Our guest is going to be Penny Reed, and she's going to talk to us about growing our practice by converting more callers into new patients. So until then, feel free to take the conversation to the Facebook page. Again, let me know if you have not gotten your invitation, and I'll be happy to send that out to you. Heidi, once again, thank you so much. This was very, very informative.
Thank you so much for having me. It was an absolute pleasure.
Right, Virginia, you can wrap it up for us.
Thank you, Teresa and Heidi. This concludes today's AADOM webinar. Thank you all for attending.